Back. I am joined by Dr. Casey Harbine for another edition of Morning Rounds. Thanks for waking up with us today.
Yeah, you bet.
Today's topic, pancreatic cancer. Of course, Alex Trebek says that he has stage 4 pancreatic cancer that he announced. And what many may be wondering is what exactly that means.
So the pancreas is an organ that sits in our mid-abdomen behind our stomach, and it's responsible for a lot of digestive things, helping us break down food. It also has some hormonal responsibilities, makes insulin, things like that. When we talk about stage 4 cancer, it's usually on a spectrum, 1, 2, 3, 4. Stage 1 is where it's just isolated to the organ in which it is. Stage 4 is the most advanced, where it's spread to other organs, other areas of our body.
Is pancreatic cancer curable?
Well, so of all pancreatic cancer diagnosis, when we talk about cancer survival, we talk about a 5-year survival, which doesn't necessarily mean it doesn't ever come back, but after 5 years, we say someone's in remission. Of all diagnoses, so stage 1 through 4, the 5-year survival is 8.5%. It's very low. When we talk about stage 4, it's never yet considered curable. For one, you can't cut it out. It's still in other areas of your body. It gets out, the cancer cells get out in the bloodstream, and they can land in other areas of your body. Pancreatic cancer, has the highest mortality of all cancers.
And why does it have the highest mortality rate?
One reason is that it's probably discovered so late. You don't really have many symptoms until it's doing something that is obstructing a normal bodily function, or it's involved in another organ, so it's usually discovered pretty darn late. The other thing is we don't really understand what the risk factors for it are, so we don't know how to try and prevent it, and there isn't any kind of good screening test or knowing who to screen, and so it's not really discovered until it's causing a problem. By then it's often too late.
And what kind of treatments are available?
So if you have an early pancreatic cancer, sometimes you can have surgical removal. The surgery involved is pretty poorly tolerated, particularly by older people, which is the vast majority of who gets diagnosed with pancreatic cancer. There is a number of different chemotherapy options that can be well tolerated in people, that can treat and help improve length of life for treatment of it, but that's about what we have now.
How many people get it?
So lifetime risk for pancreatic cancer, men and women, is 1.6% in their lifetime. So it's not a huge risk. I mean, compare that to women. Their lifetime risk of breast cancer is 8%.
Yeah.
But certainly, probably one of the biggest risk factors is age. And the older you get, the higher your risk of getting it.
Is there any prevention?
No, not that we're really aware of. Smoking is one of the leading causes of all types of cancer. Right. There's always some concern for recurrent pancreatitis and inflammation in the pancreas and things like that. But right now we don't really have a good understanding of risk factors, and so it's hard to know how to prevent.
All right, well, thank you for answering some of those questions for us. If you have any questions you'd like us to answer here on Morning Rounds, you can just email them right to us. morningrounds@kpax.com.